If you have been taking a blood pressure pill every single morning for the past year, amlodipine, losartan, or lisinopril, let me ask you something. How confident are you that you truly understand what that pill is doing inside your body right now? Not what the pharmacy label says, not the one-line summary printed on the side of the bottle. I mean, really understand it. How it works, what parts of your body it changes every day, what side effects are simply annoying, what side effects are warning signs, and what symptoms should make you stop everything and get help immediately. Because most people do not know. And I do not mean careless people. I mean thoughtful people. Responsible people. People who manage their finances, keep up with appointments, read the news, take their pills on time, and do their best to stay healthy. When I ask them what their blood pressure medicine actually does beyond it lowers blood pressure, most of them pause. And that pause says a lot. Because these are not weak medications. They are not harmless little tablets. They are powerful drugs that influence your arteries, your kidneys, your heart, your fluid balance, and your body's internal chemistry every single day. Yet millions of older adults take them almost on autopilot. Same bottle, same morning routine, same swallow with a sip of water, and often very little understanding of what to watch for, what to avoid, or when something that seems small is actually your body trying to tell you that something important has changed. That is what this video is about. By the end of this, you are going to understand amlodipine, losartan, and lisinopril in a way that can make you safer, calmer, and much less likely to be caught off guard. And I want to start with a story, because stories make this real. A man I will call Walter was 74 years old. Sharp mind. Organized, former engineer, the kind of person who followed instructions exactly. His daughter had set up one of those pill organizers labeled Monday through Sunday, and he treated it like a precision system. He never missed a dose. When a new prescription for amlodipine was added to his blood pressure routine, Walter thought, it is just another blood pressure pill. Different name, same general thing. That assumption nearly cost him a year of mobility and peace of mind. Within a few months, his feet and ankles had swollen so much that his regular shoes barely fit. By late afternoon, his legs felt heavy, full, and uncomfortable. He started walking less because movement made the heaviness worse. He became worried something serious was happening with his heart or circulation. He even started searching for signs of heart failure. But what was happening was not heart failure. It was not sudden kidney failure. And it was not simply getting older. It was a classic side effect of amlodipine, something entirely understandable and often manageable once someone explains what to look for. That is the first big point I want you to remember. These three medications are not interchangeable. Yes, they all lower blood pressure. But that is where the similarity ends. Amlodipine is a calcium channel blocker. It lowers blood pressure by relaxing the muscles in the walls of your arteries so they widen and allow blood to move with less resistance. Lisinopril is an ACE inhibitor. It blocks an enzyme involved in tightening blood vessels, so blood pressure comes down through a different pathway. Losartan is an ARB, or angiotensin receptor blocker. It works in a similar blood pressure control system as lisinopril, but it blocks the signal at a different step. 3 different drug classes. 3 different mechanisms, 3 different side effect patterns. And that matters more than most people realize. Because when you understand which family your medication belongs to, you stop treating every symptom like a random mystery. You start seeing patterns, and those patterns can protect you. So let's go deeper, starting with the one side effect that causes an enormous amount of confusion, swelling from amlodipine. A lot of people who take amlodipine notice that their socks leave deeper marks. Their shoes feel tighter by evening. Their ankles look puffier. Their legs feel heavy. And the first thought is usually, I must be retaining fluid. Sometimes they assume it is too much salt. Sometimes they worry their kidneys are failing. Sometimes they fear it means their heart is weakening. But the usual explanation is actually much more specific. Here is what happens. Amlodipine relaxes the small arteries very effectively. That allows more blood to flow forward into the tissues. But the veins, which return blood back toward the heart, do not relax in the same way. That imbalance means pressure can build up in the tiny blood vessels near the ankles and feet. When that pressure rises, some fluid gets pushed out into the surrounding tissue. That is why the ankles swell. That is why the feet puff up. That is why your legs can feel heavy by late afternoon, even if your weight has not changed much. In many cases, this is not water retention in the way people imagine it. It is a mechanical side effect of how the medication affects blood vessel tone. And the truly dangerous part is often not the swelling itself. It is how people respond to it. Some people decide, without telling anyone, to stop the medication entirely. Then their blood pressure quietly rises again, and they think they solved one problem while creating another. Other people make a different mistake. They start drinking less water because they think water is causing the swelling. But dehydration can make dizziness, kidney strain, and blood pressure instability worse. And many people do what Walter did at first. They say nothing. They just live with it. They walk less. They worry more. They lose activity and confidence for no reason. The better response is simple. If you develop leg or ankle swelling on amlodipine, bring it up. Do not hide it. Do not guess. Do not assume the worst. It may mean the dose needs adjusting. It may mean the medication can be paired with something else. It may mean a different blood pressure medicine fits your body better. But none of that can happen if nobody knows. Now let's move to lisinopril, because this one has a side effect so common and so oddly deceptive that people miss it for months. The cough. If you have ever heard someone say, "I have had this dry little cough forever and nobody can figure out why," lisinopril should always be somewhere in the back of your mind. This is not the kind of cough that brings up mucus. It is not usually a chest cold type of cough. It is more often a dry, scratchy, irritating tickle in the throat that just will not go away. And here is why it fools people. It often does not begin right after starting the medication. Sometimes it appears in the first week, yes, but sometimes it shows up 2 months later, 4 months later, even longer. By then, most people never connect it to the pill they have already been taking without any obvious issues. So they blame allergies, or dust, or the weather, or reflux, or a lingering cold, or postnasal drip. I once heard about a woman I will call Evelyn, 71 years old, who loved gardening. Her cough began during pollen season, so she naturally assumed the outdoor air was the cause. She tried antihistamines. She bought an air purifier. She adjusted what she ate at night. She even had imaging done, and nothing obvious turned up. Months passed. She slept poorly. She became exhausted. She was frustrated because something so small was affecting her every day, and nobody seemed to be connecting the dots. Then, someone looked closely at her timeline. She had started lisinopril months before the cough began. Once that connection was made and the medication plan was changed with her regular doctor, the cough faded away over the next couple of weeks. That is how subtle this can be. Now I need to draw a sharp line here, because there is a symptom associated with lisinopril and other ACE inhibitors that is not a nuisance. It is an emergency. If you are taking lisinopril and you develop swelling of the lips, tongue, throat, or face, especially if you feel trouble swallowing, hoarseness, or any change in breathing, that is not something to watch and wait on. That can be angioedema, and it can become dangerous quickly. A dry cough is irritating. Swelling of the airway is urgent. Those are not in the same category, and it is essential that you know the difference. Now let's talk about losartan, because losartan has a different type of hidden risk. And what makes this one so interesting is that it often happens to people who are actually trying to do the right thing. Losartan, like lisinopril, affects the body's renin-angiotensin system, one of the major systems that helps regulate blood pressure and fluid balance. One possible effect of this class of medication is that potassium levels can rise. That usually stays manageable when someone is being monitored properly. But trouble starts when hidden sources of potassium enter the picture. A lot of older adults have been told for years to cut back on salt, so they switch to a healthier salt substitute. Seems reasonable, right? But many salt substitutes do not simply remove sodium. They replace it with potassium chloride. So now someone is using a medication that can raise potassium, while also shaking extra potassium onto their food every day, thinking they are making a heart-healthy choice. That combination can quietly push potassium higher than intended. And high potassium matters because it can affect the electrical rhythm of the heart. The hardest part is that potassium problems do not always arrive dramatically. Sometimes it is subtle weakness, sometimes unusual fatigue, sometimes muscle cramps or tingling, sometimes a strange fluttering feeling in the chest, and sometimes there are few symptoms at all until the problem becomes more serious. That is why salt substitutes, sports drinks, electrolyte mixes, meal replacement powders, and over-the-counter supplements matter so much more than people think. They may seem small, but in the setting of losartan or lisinopril, they are not always small. This does not mean potassium-rich foods are bad. It does not mean losartan is unsafe. It means combinations matter. And if you use salt substitutes or potassium supplements while taking losartan or lisinopril, that is something your doctor should absolutely know. Now let's move into one of the most under-discussed topics of all. What happens when you get sick? Not a major hospital illness. I mean, a stomach bug. A few days of vomiting. Diarrhea that will not stop. Poor appetite. Flu. A hot spell in the summer where you sweat more than usual and do not drink enough. When that happens, the body changes. Fluid volume drops. Blood pressure may fall. Kidneys become more vulnerable. And a medication dose that was perfectly fine when you were healthy may suddenly behave very differently in a dehydrated body. This is especially important with losartan and lisinopril, and it matters with blood pressure medicines in general. A person who cannot keep fluids down, or who has been losing fluid for a day or two, may be at greater risk for low blood pressure, dizziness, fainting, or kidney stress if they continue certain medications without guidance. The medication did not suddenly become bad. The conditions inside the body changed. That is why every older adult taking blood pressure medication should have what is often called a sick day plan. In plain language, that means you should know ahead of time what to do if you get dehydrated, cannot keep food or fluids down, or develop a serious stomach illness. Do you hold the medication? Do you continue it? At what point do you call the office? What symptoms mean you need urgent medical care? Those questions should not be figured out in the middle of a miserable night when you are weak and dizzy. They should be discussed in advance. If your prescribing doctor has never given you that kind of plan, it is worth asking for one. Because illness changes the rules. Now let's talk about a trap that catches a huge number of people and often begins with nothing more than everyday pain. A bad knee, back stiffness, arthritis flaring up. So you go to the store and grab ibuprofen or naproxen. No prescription. Right there on the shelf. Something you have used on and off for years. And that seems harmless. But if you are taking lisinopril or losartan, and especially if you are also on a water pill, that combination can put real strain on the kidneys. This is not rare. It is not some strange edge case. It is common. The reason it gets missed is that people do not always think of over-the-counter pain relievers as serious medication. They think of them as casual drugstore items. But your kidneys do not care whether something came with a prescription label. They respond to chemistry. Anti-inflammatory medicines like ibuprofen and naproxen can reduce blood flow into the kidneys. ACE inhibitors and ARBs change kidney blood flow regulation in a different way. Add dehydration or a diuretic on top, and the system becomes much more vulnerable. That does not mean you can never take them. It means the combination deserves respect. If you routinely rely on anti-inflammatory pain relievers and also take these blood pressure medications, talk about it openly. There may be safer options depending on your situation: acetaminophen, topical treatments, heat, physical therapy, or other pain strategies that do not carry the same kidney risk. Now let's spend a minute on something that sounds minor, but in older adults can change everything. Dizziness when standing up. You rise from the couch, or get out of bed, or stand up from the toilet, and for a second the room tilts. You catch yourself on the wall or the dresser. Then it passes. A lot of people dismiss that. They say, "I just stood up too fast." But here is what I want you to understand. For an older adult, a few seconds of lightheadedness is enough time for a fall. And one fall is enough for a fracture. And a fracture, especially a hip fracture, can alter the next several years of someone's life. This is not exaggeration. This is exactly how small symptoms become big outcomes. Blood pressure medications can contribute to that dizziness because they are doing their job. They lower pressure. When you stand up quickly, your body may take a moment to adjust. During that moment, blood flow to the brain can briefly drop, and you feel that wave of lightheadedness. Sometimes the fix is simple. Stand slowly. Pause on the side of the bed before getting up. Hold on to something stable. Give your body a few extra seconds. But if dizziness is happening regularly, or if it never improved after the first few weeks of a medication change, or if you ever feel close to fainting, that deserves more than a shrug. It may mean the dose is too aggressive. It may mean your hydration is off. It may mean your medication combination needs a second look. And silence on this issue is not harmless. Now we need to talk about home blood pressure readings, because this is where fear causes a lot of bad decisions. Blood pressure is not a fixed number. It changes all day long. It changes with sleep, stress, pain, caffeine, talking, walking, weather, anxiety, about the reading itself. One high number on a bad morning does not automatically mean your medication has failed. One lower number after a hot day does not automatically mean the medication is suddenly too strong. What matters most is the pattern, the trend, the consistency of how you measure it. Same arm, same chair. After 5 minutes of sitting quietly. Not while talking. Not right after walking across the house. Not in the middle of a stressful argument. When people take random readings at random times and then react emotionally to single numbers, the next step is often a mistake. They take an extra dose. Or skip a dose because one reading looked good. Or panic over a number that means very little without context. A better approach is boring. And boring is good. Measure it with a routine. Write it down. Bring the log to your appointment. Let the pattern tell the story. That gives your doctor something usable. And it protects you from making fear-based medication decisions at home. Now let's talk about a final point that is incredibly important. These medications only work well when they are taken consistently. Amlodipine, losartan, and lisinopril are not rescue medications. They are not like taking a pain reliever after a headache starts. They work best through a steady presence in your body. That means extra doses when you are anxious are not the answer. Skipping doses because you felt fine is not the answer. Doubling up because a reading looked high is not the answer unless you were explicitly told to do that. The power of these medications is in rhythm, not reaction. Steady dose, steady timing, steady monitoring. That is how they protect you. And once you understand the side effects and warning signs, you can take them with far more confidence and far less confusion. So let's bring this all together. If you take amlodipine, remember the pattern. Swelling in the legs and ankles may be a medication effect, not automatically heart failure or kidney failure. Report it. Do not guess. Do not suffer in silence. If you take lisinopril, remember the pattern. A persistent dry cough may be the medication even if it started months later. But swelling of the lips, tongue, face, or throat is urgent and needs immediate help. If you take losartan, remember the pattern. hidden potassium can matter. Salt substitutes, electrolyte mixes, and supplements may not be as harmless as they seem. If you take any of these medications, remember the bigger picture: dehydration changes the game. Anti-inflammatory pain relievers can interact in important ways, dizziness can lead to falls, and one random blood pressure reading should never run your emotions or your dosing decisions. Most importantly, do not take powerful medications blindly. Take them with awareness. Take them with a plan. Take them with enough understanding to know what your body might be telling you. That is how you become safer. That is how you stay independent longer. That is how you avoid turning manageable issues into bigger ones simply because nobody explained the basics clearly enough. If you made it this far, here is the simplest takeaway of the entire video. Your blood pressure pill is not just a number-lowering tablet. It is an active force inside your body every single day. When you understand how it works, what it can affect, and what symptoms matter, you become much harder to catch off guard. And that knowledge can protect you just as much as the medication itself.